Hello everyone. I would like to start by thanking the organizing committee very much for inviting me to give this presentation today, and especially my very good friend Dr. Saiful Haq and Dr. Kamal for their leadership in organizing this event along with other colleagues and all the sponsors. The title of my talk is going to be Global Radiation Oncology, High Impact Areas and Opportunities for Collaboration with the United States of America. I'm excited about this topic because I love collaborations. In fact, as you know, today they say that global health is local health and local health is global health. The reason why that's partly true is because if you and I can collaborate across the globe, you in your community can have an impact in your community and I can have an impact in my community, and together we can have an impact across the globe. So that is really, really important. Now, my talk is going to have three parts. The first part, I'm just going to give some background and introduction. That will be followed by sharing about some high impact areas for collaboration. And then lastly, I will share some opportunities for collaboration with the United States of America. Now, I always start, each morning when I get up, thinking about these statistics. Over 18.1 million cancer cases a year, according to the World Health Organization. Over 9.6 million deaths a year. The economic impact of about $2 trillion, according to some estimates. I call these monster statistics, and I really think that we have to work together to address this. 70% of the cancer deaths, that's the worst thing about this, happen in low and middle income countries out of those 9.6 million deaths. And so these are the countries which have the least capacity to deal with the cancer. And so I look at this cancer as a monster. If you look on this picture to the right side of your screen, it pictures a monster. His name is Thanos. You may know him if you like movies. He's the villain in the blockbuster movie Avengers Endgame, where he gets up one day, he decides that just with a snap of his fingers, he can wipe out half the universe population, and he has the Infinity Stones at that point. You can see this in his hand, shining these bright lights, and he does have the ability to do that. And I look at this monster like cancer itself. In fact, it had to take all the Avengers working together in collaboration to defeat this villain. Black Panther had to come together with Captain America and Iron Man and Thor and the Hulk and all other superheroes. And that's the same thing that we must do. We can all become Avengers against cancer by collaborating, because collaboration is key in the fight against cancer, especially in addressing these disparities where low and mid-income countries do not have access to the same level of care. This map here is actually a really good map to capture and show what these disparities are. So you can see in the green, which is part of mostly North America, including United States of America, there's significant, really high quality access to radiation therapy. Now, if you want to look at the red parts, they are mostly in Africa and also Southeast Asia, where people have much more limited access to radiation therapy. Now, it shouldn't be that just because you're born somewhere of no fault of your own, that you should not have access to cancer treatment. And so, ladies and gentlemen, we really have to work to change this. And so that's why collaboration becomes really, really, really key. I actually would like to give you, some background about the barriers against collaboration. So I lead this program at Harvard over the past 6 years, and where we just bring people from across the world. They come and share their experiences, the challenges they are facing, the situation in their cancer centers or countries. And then we catalyze collaborations. We look for opportunities where they can connect with other people who may have solutions to the challenges they are facing. And each time they've come to Boston over the past 6 years, we can be thinking about, what are the key barriers to collaboration? And the top 4 that keep coming up are space-time barriers, cultural barriers, funding, and the human capacity. I'm going to give an example for each one of these to just illustrate. So if you think about space-time barriers, so if you're sitting there in Bangladesh and I'm here in Boston, in the United States, and we want to collaborate, we immediately face the first challenge, which is that we are separated by space and distance. And it will take time for you to travel from Bangladesh to see me, and it will take time for me to come there. So that is a barrier to collaboration. And now over the years, we've kind of developed a big focus on technology, using information and communication technologies to address this particular barrier. And I'm going to share a little bit about that in a moment. Another example for thinking about cultural barriers, simple example is language. Some countries don't even have, or some countries don't have a word for cancer in some villages. And so if you do not have a word for cancer in a language, you cannot even think about collaboration. Okay, funding is a big driver to collaboration, and then human capacity. You actually need people that you can collaborate with. If you don't have people, and that's why these events are very important, this symposium, because you can have people come together, connect, and then discuss how they can collaborate to have impact. And so having the human capacity or somebody that you can collaborate with is really, really important. In fact, nowadays, the National Institutes of Health in the United States has a map where if you go there, you can enter and it populates with people who are in that country or that region who you can collaborate with. So that human capacity is really, really important. Now I'm going to transition a little bit to talk about the high impact areas for collaboration. And I would say there are four large, broad areas. I would say care, advocacy or outreach, research, and education. And in each of these areas, you can really find that there are great examples of opportunities where people can really collaborate to have an impact. In fact, in 2019, we decided to address the space-time barrier to collaboration by reimagining the way that we can do global health. So imagine that you can take one of the best cancer centers in the world, for example, the Dana-Farber Harvard Cancer Center, and you put that in the cloud where anybody can have access to that. You just get a laptop, you log on, and you can have access to care. You can collaborate with somebody in research. You can teach somebody or access an educational resource, and any of those things. You can work with other people to advocate against cancer. And so this was supported by IBM, and one of the things they really, really liked was the idea that through such a center, everybody can become a member, and it means that you can actually pool people's time. You can take the time 1 hour from each person. For example, you can go to somebody and say, can you donate 1 hour of your time a week? Do you have that availability? You can go to each person and they can pool that time together, and then suddenly everyone has access to the best professor in the world or the best cancer specialist. You can kind of pool that time, and so it wouldn't matter where you are, you can have access to that. And so I'm just gonna highlight key areas for high impact collaborations under each of these four main areas. Under care, one of the key areas that you can really have impact is in second opinion. Over and over, we find doctors in low and middle income countries who work in silos by themselves and just want somebody to say, this diagnosis, this prescription that I'm giving for treatment is the correct one. In fact, working with IBM, we've been developing artificial intelligence that can actually populate, where if you enter the diagnostic report of a patient, they can make suggestions. Artificial intelligence can make suggestions to you about what the best treatment are. Now you are still going to be the ultimate person to make the decision about that treatment. Remote consultation. So now people can actually telemedicine. This has become a big deal during COVID-19. And so, this is something that you can really have a high impact. Remote treatment planning and quality assurance support. So we've actually had systems now and technology like ProNow or Quality Assurance and Review Center platform where people can get on and can actually support other cancer centers through remote treatment planning and quality assurance. One other big area is tumor boards. Tumor boards, we collaborate. We have even the diaspora. So you have, a lot of specialists living outside of their country. They can actually partner with their local hospitals and can be able to do tumor boards and discuss very complicated cases. And that can really, really improve the quality of care in these centers. I also want to highlight the fact that advocacy is the second high impact area of collaboration. In fact, this is one of the areas where everybody can participate. Everybody can be an advocate against cancer. You can work with industry. They are a very big part of collaboration. You can reach out to them. Working with government and policymakers. I'm actually one of those who develops recommendations for the US government every year on global health, where you can actually shape policy to have high impact. Working with the diaspora, instead of talking about brain drain, you can find ways that you can turn brain drain to global health gain. Where you can give a diaspora person, Dr. Saiful Haq is it's a good example of a diaspora person who is helping to have an impact in their sending countries or community. And I think that this is something that we all can reach out more to diaspora and diaspora organizations who can even allocate part of their budget towards global health. Another idea of outreach, obviously, where you can have high impact example is like this symposium that's been organized. When you organize events like this, you actually create opportunities for outreach. You bring people together and they can be able to catalyze collaborations. You can catalyze collaborations by bringing them together. And so we actually see that as an important part of the Comprehensive Cancer Center in the cloud that we started. Because you can have these events every year and bring people together to share knowledge and collaborate. All right, another area of collaboration that can have high impact is research. One of the very successful ones that we have been developing is co-mentored research, where you can provide seed funding to trainees in your hospital or in your institution, and they can conduct research. We both can publish, so co-authorship from US institution and also from the United States. And in that way, you can actually share knowledge and even use that publication to get funding. Multi-center clinical trials. We are now setting up this. There's actually an NIH-funded platform called the Quality Assurance and Review Center, where we can collaborate in multi-center clinical trials research, and I can make sure that the protocols that are being implemented in the clinical trial in your hospital are the same that are being implemented here at the Dana-Farber Harvard Cancer Center or at other cancer centers. So that's a really good way where technology can drive research collaborations, can have a high impact. Then you make sure that clinical trials like hypofractionated radiation therapy are not just coming from Europe or the United States, that they actually involve those low and middle income countries as well. And so that's really, really important. I just give you an example about this hypofractionated radiation therapy. We published a study last year basically showing that this can be a really high impact area. We show that for centers in Africa, if they hypofractionate, they can save billions of dollars for prostate cancer and breast cancer alone. Let me give you an example. It's not just about the money. So if you are treating a patient for prostate cancer who has to come in 35 to 37 times, 35 times 2 gray, 35 fractions times 2 gray, for example, and you hypofractionate that to say 7 fractions times 6 gray, which is what came out recently in the Lancet Oncology, then suddenly the time it takes to treat one person, you can use that same time to treat 6 to 7 people, which is big for countries where they have limited access to radiation therapy. And so, but the problem right now is that those clinical trials have been done only in the United States and Europe. We don't have any of the data for low and middle income countries. So that right now, we actually starting this summer is going to be one of the great areas where we can also collaborate. And we can then recommend this as a policy for adoption by these countries or the World Health Organization for low and middle income countries. All right, another big area is education, education and training. As you know, we need about 7,500 radiation oncologists. We need about 6,000, medical physicists. We need 20,000 radiation therapists, according to Lancet Oncology publication. And that really highlights the need for us to have as many as focused on education as possible. We have to collaborate on that. In fact, the great thing about radiation knowledge, like this event, is that people can actually do continuous education here, continuous medical education, through these tournaments that are going to be organized as part of this whole event. People can increase their skills. That is educational. And there are other ways that we can collaborate long-term in education and training. And so through online learning, complementing that with, practical training at local sites, you can have a tremendous impact. All right, I actually want to show this example where, we did training by just teaching doctors how to contour using technology like Pronow. They sat in different hundreds of doctors basically across Africa were able to participate in this training, and they learned how to contour. You can see the jump in skill level to contour from the red to the blue, and that was really helpful, and we believe that that really improved care for these people, where they probably are working in silos by themselves and don't have this kind of exposure to educational training. All right, so I just want to end this particular part to say that there are 4 large areas where you can have high impact collaborations. There's care, advocacy, research, and education. And the Comprehensive Cancer Center in the Cloud represents one of those ways that you can have each of these aspects. It's like a mall where you can walk into and be able to collaborate in any of these high impact areas to eliminate cancer. Now I'm going to go to the last part of my talk, which is just sharing a little bit about some opportunities for collaboration with the United States of America. The first one is on care. I already highlighted this about the Comprehensive Cancer Center in the Cloud, where you can do tele-oncology. We've been very successful in doing some of these for Africa, and now on where you also saw that was red on that map. And now we actually really like to partner with people in Southeast Asia to be able to extend this. And so there are opportunities here. If you're really interested, this is something we can talk about. Tumor boards. Tumor boards are also another area where you can have collaborations with institutions in the United States of America. There are many examples happening. MD Anderson working with other centers in Africa. We have Memorial Sloan working with cancer centers in South America. We have people across the world working together on tumor boards to actually help improve care. Remote treatment planning and quality assurance support. Like I mentioned, you can have this now with the technology that we have. There's vendor technology, and there's also freely available technology that can be adopted to increase access or quality healthcare in cancer centers. Now, if you think about art advocacy as well, I mentioned that this is one area where everybody can collaborate. So we actually have a Global Health Catalyst Conference coming up in September. I think it would be nice. We actually plan to collaborate with Radiation Knowledge on this event. And I think that we were actually looking for partners in Southeast Asia for this. Last time we did this event, we had a number of people come from Bangladesh, and we would like to grow that participation and create more opportunities where we can find opportunities to collaborate as well. The tournament with Radiation Knowledge, we actually plan to do one as part of advocacy and outreach together with Radiation Knowledge. And so we already have funding lined up for this, and we're looking forward to collaborate for this. And then I would say that one really great areas for collaboration is in grant funding. So right now, the National Cancer Institute Center for Global Health is putting out a lot of opportunities for collaboration. And so they are really looking for having U.S. institutions which can collaborate with institutions in low and middle income countries. And so this will be an opportunity where we can also collaborate. Opportunities for research, like I mentioned, we already have a Hypo fractionated radiation therapy clinical trial coming up in the summer. If you're interested in this is something that we can collaborate on. We also are establishing about 25 microgrants for co-mentored research, where we can get people from Bangladesh to be able to participate and get money to generate preliminary data, which can then allow them to apply for even larger funding. We have the co-mentorship opportunities that have faculty from really top institutions, and so we'll be looking forward to working with faculty or oncologists in different countries in your country. We can partner together on this to conduct research. So this is really going to be one of those areas where we can work together. And then on education, finally, education is a big part. So like I mentioned, we will be collaborating with Radiation Knowledge. But, overall, we do have a possibility where you can have, education collaborations with institutions in the United States, mostly continuous medical education, short term, or workshops, where they're just building skill, either to do, like contouring or to do treatment planning and stuff like that. So that's really valuable. So those are opportunities where we can definitely collaborate. Now, I also want to highlight one which we started. It's called the Global Oncology University. So it's not just going to be continuous medical education. We actually partner with sites in local sites in different countries, to offer the high quality education online where they can have access to the best professors, but then they can have their practical training at their local sites. And so that also leads to residency and degree programs. And so this is something where we can partner together with people in Bangladesh or other parts of the world as well to extend to Southeast Asia. That's a really good opportunity. Okay, I would like to end by just acknowledging, faculty from so many different institutions and support from industry that has really helped us move, the global health. Global radiation oncology has become en vogue right now, and so there are many opportunities where we can actually collaborate thanks to these partners. Thanks for your attention. I'll be willing to answer any questions that you may have.